I move that, in the opinion of this House, the Wynne government must immediately increase the number of long-term care beds in the counties of Simcoe and Grey so as to eliminate the wait list of people who can no longer stay in their own homes and or are stuck inappropriately in a hospital bed through no fault of their own.
Mr. Wilson has moved private member's notice motion number 67. Pursuant to Standing Orders number 98, the member has 12 minutes for his presentation.
Speaker, there are more than 27,000 seniors living in my riding, and they make up more than 21% of the population. As we all know, our seniors need and require services that are funded by the province of Ontario. Without these services, our seniors would not be able to live comfortable and independent lives in their elder years. One of the most important services our seniors rely on is the provision of long-term care beds. In my constituency offices in Collingwood and Alliston, long-term care is one of the biggest issues we have to deal with almost on a daily basis. I'm very familiar with the issues facing our long-term care facilities. I visit the homes on a regular basis, and I speak directly to staff and residents. I talk to doctors about their concerns and frustrations with the present system. When I meet with hospital administrators, long-term care is a frequent topic we discuss. The issue is simple. There's a growing need for long-term care services and not enough beds to meet those needs. My offices deal often with elderly residents under hospital care trying to navigate the system. Ideally, they would be able to return home with full PSW support to allow them to continue to live in their own homes. However, there are never enough personal support workers or enough PSW hours assigned to meet the demands. A constituent recently contacted my office and provided an illustration of the depth of the PSW shortage. My constituent, who I know very well, told my office his family was informed that they may never get home PSW support for their parents, although both parents qualify for 56 hours of personal support care per week. There are no PSWs in that area to provide that care. Instead, they were given a list of private home care companies to call. The parents are also on wait lists for beds in long-term care, but there are no beds. I find that astonishing. This government is actively ignoring people in need. Madam Speaker, this needs to change. Many people trying to enter a long-term care facility find themselves on the waiting list. For these residents, the wait can be a very long time indeed. Here are just 3 examples of average number of days per person. A person needing a bed has to wait in parts of my riding. At the Stayner Care Centre, it's 296 days. At the Bay Haven Nursing Home in Collingwood, it's 345 days. And at the Collingwood Nursing Home, it's 343 days. Many residents are forced to make the tough decision to accept care from outside their local area. This creates pressure on the long-term care centres in neighbouring ridings and creates hardships within families. Imagine the shock of having to move your spouse out of the family home into a care centre and then finding out the wait time may be a year or more. Then imagine making the difficult decision to get them the care they desperately need, but being forced to go to another community. How can we expect someone to travel great distances on a regular basis to visit their spouse or loved one? It's unfair and it's cruel. Our seniors deserve to receive the care they need close to home, where they have their doctors, their friends, family, and other support systems. Speaker, citizens are losing confidence and are uncertain about the future of long-term care in this province. According to a recent NANO survey conducted with the Ontario Long-Term Care Association, more than half of the respondents are not confident the province is investing what it should to ensure long-term care homes are providing quality care. This should be a major concern to the government. Our population is aging, the wait list for beds has increased to 32,000 people, and there are now more people over the age of 65 than under the age of 15 in Ontario. The government can't ignore this issue anymore. It can't be swept under the carpet. The Ontario Long-Term Care Association recently released its 2018 budget submission. While there are many areas of long-term care where more support is needed, I just want to give you a direct quote from that report. Approximately half of Ontario's long-term care homes are still without a dedicated in-home BSO, which is a Behavioural Supports Ontario resource. Some 44% of the sector's homes are dated and require renovations or to be rebuilt. And as seniors enter care, much older and frailer than previous generations, their needs call for more direct care hours, both from personal support workers and from skilled staff such as registered nurses, registered practical nurses, and nurse practitioners. In short, Ontario seniors will need more care and better care, and that's a direct quote from the report. Speaker, there are no shortages of stories out there about what we face as a province with this issue. From Ron Weiss, who emailed my office. He said, "There's clearly a shortage of long-term care facilities and beds, which means that a growing number of seniors do not have access to timely quality care. I'm asking you, as my MPP, to fight to make sure that more healthcare spending is committed to long-term care, so wait times decrease and seniors get the kind of care they really need." From Candace Rennick of CUPE, who emailed me to express support for Bill 33, the Time to Care Act. Maybe you're even like me and you visited your dad one evening to find that the 52 residents on the Alzheimer's floor were locked in overnight with only 2 staff for an entire 12-hour shift. Maybe you've seen the sad indignity of a loved one waiting and still waiting to be toileted, or even to be dressed and fed because there's just not enough staff on the floor to keep up. For the ones we love so much and who have done so much for us over their lives, surely that's just not good enough. We can do better. From Dr. Nancy Biles of the Alliston Family Health Team Seniors Clinic, who earlier this year I met with, and she forwarded a copy of her proposal for a geriatric hospital for Alliston, which has so far, by the way, been ignored by the government. The current level of health care for seniors is inadequately funded, she said, to meet the demands of our rapidly aging population. Dr. Biles said family doctors have problem addressing the needs of seniors due to funding limitations in the current fee-for-service model. Quote, "The time required to provide care for a senior in crisis is in conflict with fee-for-service physicians that require speed, volume, and efficiency in their patient care." In her proposal, she said new modes of care need to be embraced. Quote, "Fundamentally, the new senior care models need to be that the patient, to ensure that the patient is given an opportunity to address the complexity of all medical problems that they possess in a comprehensive manner." Speaker, I must say the shortage of long-term care beds is shocking. Wait lists continue to grow, our population continues to age, and yet this government has done virtually nothing to address this issue. In my days in government, and I was a former health minister, I remember we approved over $2.1 billion of new money to build new 2,000 nursing home beds or long-term care beds, and to rebuild 16,000 beds in older facilities. And I remember quite distinctly being criticized both in this House and through the media by then opposition Liberals for overbuilding. It was the first time I'd ever heard the term of overbuilding in healthcare. But unlike this government, we recognized the system needed new beds and we needed to meet future demands and plan ahead. Today, our long-term care facilities, this is astounding, are 99.9% full 100% of the time. In the homes in my riding, wait lists continue to grow. At Simcoe Manor in Beaton, there are 181 people waiting. At Good Samaritan in Alliston, there are 100 people on the list. At Bayhaven in Collingwood, there are 58. At the Collingwood Nursing Home, there are 37. At the Stainer Nursing Home, there are 49 on the list. The list at Sunset Manor in Collingwood is 196 people, and at Creedon Valley in Creemore, the wait list is 18. And what has the government done to alleviate this issue in Simcoe Grey? Well, since 2003, my riding has received exactly a total of 18 new beds. Just 18 beds since 2003. What more evidence do you need to realize that something must be done and must be done urgently? These are the numbers from the facilities in my riding. Across Ontario, wait lists and times continue to grow, and other members will speak about that, I'm sure, during their comments today. Current statistics tell us that by 2021, that's only, 4 years away, the wait list province-wide for long-term care beds will be close to 50,000 people. It's 32,000 today. Since 2003, this government has claimed to have created just over 10,000 new long-term care beds. But when you break that down, that's just over 700 beds per year for 14 years. With a wait list today, which stayed constant over those years at about 32,000, opening 700 new beds per year won't get you too far to solving this problem. The crisis is affecting our hospitals. In my riding, Collingwood General Marine Hospital and Alliston Stevenson Memorial Hospital are seeing precious resources tied up by patients waiting for a long-term care bed. Jody Levesque of Stevenson Memorial Hospital said, when we look at the overall number of days patients occupied a hospital bed instead of their preferred destination for care, over the last 3 years, this has represented 1,304 days. And when you consider this as a 38-bed hospital, it means at times more than half of the beds are filled up with ALC patients. Collingwood General Marine, a 68-bed facility, says at any time 15 to 17 of those beds are regularly filled by patients waiting for long-term care bed. and this places a lot of strain, obviously, on the resources of that hospital. An interesting thing there is Anita Chevalier, the hospital's Chief of Performance and Clinical Systems, told me that something I hadn't thought of, but if the government would come up with, and it has been talked about a bit around here, some subsidies or some assistance to families for those loved ones that can't get a long-term care bed, don't need a hospital bed, but could do very well in a retirement home for a while, but can't afford the $3,800, $6,000 a month fee of the private retirement home. Maybe we can do something there, and I know the government did mention that last year as a way to help alleviate some of the backlog. Speaker, I want to say that the government has announced recently that it's going to build 5,000 new beds over 4 years, and they announced a vague plan for 30 beds over 10 years. But given the track record, how can we believe this government? I mean, they took $50 million out of the system for seniors when they cut physiotherapy a couple of years ago. They've not kept up with the need for long-term care beds. They've consistently heckled and told us that we were wrong to want to build beds. They actually had a policy for a number of years that said we will build no beds. So it's like hospitals. That is coming back to roost. If you have a hiatus of a number of years where your policy is everybody's going into PSW care in their homes, or their loved ones are to look after them, you're obviously going to come when the population is aging and growing as fast as it is with respect to our senior population. You're obviously going to hit the wall, and I'd say you've hit the wall now with a projected 50,000 on the list. You know, families just can't cope anymore, and we don't have the family units that we used to have. Children are scattered all over the world, all over the country, all over the province. I know in my own family, I was the only one left out of 6 kids to care for my parents, and thank God my other siblings were able to contribute financially, and we were able to get private care because there was no government care available, and I'm the guy that set up the community care access centres. I remember creating the name in my office one day and then setting them up, and it hasn't worked out the way it was supposed to work out. And you're not making them any better when you say 39% is gone to administration. The gold rule standard is 6%. So you need to do a better job, implement your 5,000 beds, put most of them in Simcoe Grey, and then I'll sit down and be very happy. Thank you.
Thank you. Thank you. Further debate. I recognize the member from Kenora-Rainy River.
Thank you, Speaker. It is an honour to rise and speak on this private member's motion introduced by the member from Simcoe Grey. I would like to start by saying that I agree with the intent of this motion, that is to eliminate the wait list for long-term care services, but I have to say that this motion is too limited in its application by only seeking to eliminate the wait list in the counties of Simcoe and Grey. I know that the member is just trying to represent his constituents, and there is honour in that, but there is need for more long-term care beds all across this province. And because all of our long-term care beds are at crisis levels. I had hoped to see more leadership and vision from the PC party on this issue by calling for the funding of more beds right across the province to eliminate the wait list for all people in need of this care. The fact is that as of March of this year, there are more than 30,000 people who are on a wait list for long-term care in the province of Ontario. Wait times for people who urgently need long-term care and are waiting in hospital have increased 270% since the Liberals came to office, from a median of 18 days to 68 days. This is just a median. In northwestern Ontario, and Kenora-Rainy River in particular, the wait times for 9 of every 10 people who are waiting for this service can be as long as 1,402 days for a basic bed in Sioux Lookout. For those of you who are doing the math, that is nearly 4 years. That means 4 years of being stuck in a hospital without the necessary supports to provide the specialized care our seniors deserve, and families worrying about the safety of their loved ones. It also means that many seniors in the Northwest will not be able to even see the inside of the long-term care unit because they will never make the cut. It leaves families who can afford it to try to privately fund some supplementary hospital services, such as those of a personal support worker, for a few hours a day to make sure that the needs of their loved ones are met, even if just for those few hours. It also means that loved ones who are in desperate need of greater supports and supervision and who are lucky enough to get a long-term care bed are forced out of their home communities into other centres hundreds of kilometres away and without the personal and emotional supports they need at a time when they need it the most. In the far north of my riding, it is not uncommon for people to be sent out of their remote First Nation community to Sioux Lookout. But because of Sioux Lookout only having 20 beds to service a catchment area of 30,000, these people are then sent out even further to places like Dryden or Fort Frances, where their loved ones cannot easily visit with them, and where these facilities don't always have the ability to speak their language. The resulting poor health outcomes are painfully evident. All seniors in the Sioux Lookout region and right across Northwest Ontario are left suffering due to a profound lack of beds. One woman, Christine Sanders, wrote to me a few months back, very persuasively articulating her mother's struggle to access a long-term care bed in Sioux Lookout. I asked her if I could share her story here today with us, and I'm very pleased that she agreed because it's very poignant. She writes, "My mother has lived in Sioux Lookout since 1949. Both she and my father were always big community boosters. They took pride in their town and contributed to it, trying to make it a better place. As a child, I remember my mother lamenting the fact that elderly people had no choice but to go to Kenora or even further afield for long-term care, as there is no such facility in Sioux Lookout. Quote, it's just not right that they be sent away from their community at this stage in their lives. Not surprisingly, my mother became involved with SLECO, Sioux Lookout Extended Care Organization, a group spearheaded by the Legion and especially Rachel and Bill George. This group began agitating for a nursing care home in Sioux Lookout, and in 1991, after over years of putting pressure on governments and local fundraising efforts, the William A. George Extended Care Facility opened. Initially, it could only accommodate 20 residents, but a further 60 beds were promised. And yet, as the years went by, the demand for nursing care in Sioux Lookout increased dramatically, but these beds never materialized. Now at 93, my mother suffers from dementia and limited mobility. Since February, when it was determined that she would be unable to manage safely any longer in Sioux Towers, she has been warehoused in the hospital, along with many other seniors in the same position. She now has been on a wait list for long-term care for over a year and is 19 of 20 on that list. Care in the hospital is inadequate for her needs. Nursing staff do their best, but they have neither the time nor the specialized training to deal with elderly dementia patients. Nor do they have enough adapted equipment for the elderly, things like bed alarms or reclining chairs. Our family is in the fortunate position of being able to pay privately for a PSW to provide personal care to my mother during part of the day, but what happens at night when she is wakeful and restless? And what about those families whose means don't stretch to that? I urge both the provincial and federal governments to address this issue, to put money into this immediately and to provide the beds that Canadian elders like my mother deserve. Aside from the humanitarian issue, this stopgap measure of leaving elders to languish in the hospital is a very expensive model. Nobody wants to end their days in a nursing home, but we don't always get to choose. And I've come to realize that a nursing home would be a blessing for my mother compared to this. And we're all aging. We'll be there soon too. Sadly, Christine's mother passed away before she was ever able to see her dream of more long-term care beds in Sioux Lookout come to fruition. She died in hospital, like so many others, without ever receiving the proper care she deserves. As mentioned, there is a clear demonstrated need for additional long-term care beds in Sioux Lookout. As of a couple of years ago, it was estimated that there were more than 40 people in need of long-term care who were relocated to Thunder Bay due to a shortage of beds in Sioux Lookout. After Thunder Bay, Sioux Lookout is the largest sub-area of the Northwest LHIN, with a catchment area of, as I said, more than 30,000. And it is uniquely prepared to provide culturally appropriate care to Indigenous populations. Sioux Lookout's Menoyawan Hospital was even designed with the ability to accommodate more long-term care beds in mind. Speaker, the need for more long-term care beds in Sioux Lookout is well documented. the community is well positioned to provide an increase in culturally appropriate long-term care. In fact, there is a current proposal for an additional 76 beds in a building adjacent to the Menoyawin Health Centre that has the support of the Northwest LHIN, but has been sitting with the ministry since July 2014 with no response from the government. There is a demonstrated need for an additional or an immediate investment in long-term care all across this province, and our seniors cannot afford to wait. Ontarians from all across this province are pleading with this government to please act now. Invest in long-term care so we can address the deficit and meet future needs. Thank you.
Give further debate. I recognize the member from Ottawa South.
Thank you very much, Madam Speaker, and it's a pleasure to respond to the member from Simcoe Grey. And I have a great deal of appreciation for what he's put forward in this motion, and somewhat agree with the member from Kenora Rainy River, but I don't think I'd be as harsh as to say he didn't go far enough. I think if you take a look at his motion, you could insert all of our ridings in this. We know that it's a challenge, and to the member opposite, and I'm glad that he acknowledged the minister's announcement last week of 5,000 beds and 30,000 beds over 10 years. And I do also appreciate, I was getting heckled by a member opposite, or the minister was getting heckled by a member opposite the other day about long-term care beds, and said, you haven't built any long-term care beds, no new long-term care beds, except I was in there riding in June with them when 26 new beds were announced at the Grove in Arnprior. So, we have to be careful when we're heckling sometimes, because sometimes we forget the things that are happening. And the advocacy each of us has for the people who we represent, their families, their parents, it's critical. And I am, like I say, I am proud of the announcements that we made in their senior strategy last week. I think it's I think it's incumbent upon all of us, and I know that the member was a former Minister of Health, so he can appreciate the challenges that one has in ensuring that we can take those scarce resources and apply them in a way that ensures that people get the care that they need. As many people get the care in the right place at the right time from the right person. And that's a big challenge, and I know the member opposite knows that. I know I don't want to rehash. He was talking about hospitals, and he's saying hospitals are coming back to roost. Well, I think there were some challenges when he was minister, and I don't want to be unfair, but I have to say that out loud. So I think that to the point of redevelopment of long-term care, it is critical that we redevelop homes, that those 30,000 beds that need to be redeveloped, and I know that there are some in the member from Whitby's riding that are, I think, going in. That's a redevelopment. I was there, I think, last year. It's a redevelopment that's moving. Well, I was there, so it's going to happen. Don't worry about it. They'll get signed off on. It's part of the capital process, and so. But it was critical because those beds need to be redeveloped because it's a home. And how can a home be a 4-bed ward room? How can that be? How can we, we need to ensure that people have a certain level of privacy, that things are built to the standards that we build these days, and that's why we've had the policy of redeveloping those beds. As part of doing that, we also have to ensure that we right-size those facilities, which is, in the case of the Grove at Arnprior, you're not just going to rebuild 62 beds. What you have to do is be able to get the licenses to build 96 beds, because that's what's needed, and it's to the standard, which is about 32 beds per floor or per ward, to ensure that you can deliver care effectively and efficiently to those people. My in-laws are both in in a long-term home right now, and the care that they receive there has vastly improved their lives. They were in a retirement home before. It was a real challenge to provide the level of care that my mother-in-law needed, because she's 96, she's frail, she's elderly, she has dementia. And so, you know, we know that we need to ensure that we have enough long-term care beds. You know, the other thing we have to remember, we talk about a waiting list of 30,000, that each, I think in the last year, there was 21,000 admissions into long-term care. The other critical piece, and something that I've been working on, and the member opposite would know because I've, maybe not specifically about this, but I've had the pleasure of being in his riding at Matthew's house and seeing the good work that they're doing there and supporting that, as well as the member from Bruce Grey Owen Sound. I was up there, I think, last spring, and actually the member from Whitby as well, too, is palliative and end-of-life care and long-term care. So in last year's budget, along with the capital commitment we made to the hospice, a capital hospice program, we made an investment in the budget that is directly about palliative and end-of-life care training in long-term care. You know, long-term care for most people is the last stop. It's the place, their home. That's where they likely will pass away. So it's critical that, that we ensure that the good things that are happening in many long-term care homes to address palliative and end-of-life issues happen everywhere. And a lot of that is training, but it's also building a culture. It's building a culture that allows for care to be delivered with things like ensuring that there's family involvement, ensuring that when you intake a new resident, that there's a very clear understanding of permissions and wishes, and that their life plan can be thought about and organized so that they're ready and that the home is ready when that time comes. So I'm really proud of the work that's being done there. I know that through the Ontario Palliative Care Network that will be a focus, one of their focuses over the next 3 years, to ensure that we are delivering palliative care and long-term care. So I also wanted to mention one thing. I just made a quick little note of this, and that you know, we keep the member opposite repeats the line that keeps saying that a cut in physiotherapy. In actual fact, we're delivering more physiotherapy to seniors than we were before we made that change. It wasn't a cut. What it was is we found a way to ensure that we were putting the right resources to the right kind of care and compensating in a way that made sure that we use those resources really well. So I wanted to mention that to the member. So since 2003, in the North Simcoe Muskoka Lynn, we have opened 333 new long-term care beds. So 50 beds at the Grove Park Home for senior citizens, 128 beds at Victoria Lodge in Barrie, 64 beds at the Ontario Long-Term Care Home for the Deaf, 55 at the Pines, and 36 beds at the Georgian Manor. So, and since 2003, we redeveloped 144 beds, long-term care home, 144 beds in long-term care homes in Simcoe. So I say that to say that there is an investment there. All members of this, each party has been on this side of the House, and we've heard in debate and heard in question period the different decisions that people had to make to ensure that that scarce resource that we have is applied in a way that ensures, the way that we feel best ensures, that the most people are getting the right care in the right place at the right time from the right person. And I know the member opposite understands that. And I appreciate and I support his motion, as I would support this motion from any member in this House. So, as I said earlier, you could literally fill in the blank there. That's something that we are working to address. There are challenges. We know that. The work that we do here, and I think I've said this before, so is imperfect. Will never be done in healthcare. Will never be done in most of the work that we do here. It's a state of continuous improvement. It's a state of continuing to push forward and work on those things that we know are critical to the people, are critical and important to the people who we represent. You know, if I go and knock on a door in my riding, I can almost assure you at every door that if healthcare isn't number one, it's number two. And it could be an issue with a senior, could be an issue with a child, and it's incumbent on all of us in the House here to work towards that goal. And the role of the opposition, as I understand, is to push and to criticize. And I really appreciate the respectful tone of this debate because sometimes we assign motives to each other, and I'll say it on both sides. And I don't think that does us good. I don't think it's a good thing to do for us to work together to ensure these things are done. So I want to again thank the member very much for the putting the motion forward and for the opportunity to speak to it, and for his advocacy on behalf of his constituents. Thank you very much, Madam Speaker.
Thank you for the debate. I recognize the member from Bruce Grey, Owen Sound.
Very much, Madam Speaker. As PC critic for seniors' long-term care and accessibility, I'm pleased to rise in support of my colleague Jim Wilson's motion to increase long-term care capacity in his riding of Simcoe Grey, and I commend him. He is among many of us here who are pushing very hard to have long-term care beds available for the people of our ridings. As a former Minister of Health, he was responsible for approving $2.1 billion in funding for long-term care. 20,000 new beds were approved, 16,000 to be redeveloped. And I wanted to say, Madam Speaker, some of the 10,000 that the current Liberal government is taking credit for were actually implemented under Mr. Wilson and the Harris government. Despite seniors being the fastest growing demographic with growing acuity needs, they've received very little attention and respect from this current government. I believe that caring for our seniors who are in long-term care homes should be one of the government's foremost responsibilities because seniors deserve dignified, safe and quality care. But as I said, this hasn't been the case under this Liberal government, despite the Deputy Premier's spin that improvements we've made to long-term care are quite remarkable and nothing short of astonishing. I respectfully remind the members opposite that we are nowhere near where we need to be. So while the Liberals promised to, and one thing they promised was to increase hours of care back as far as 2009. They promised to redevelop 35,000 outdated beds in 2007, and they promised to make improvements to alternate level of care patients. They actually failed to deliver and reneged even on some of these promises, Madam Speaker. The member from Ottawa South, who I acknowledge and we just listened to, he committed to redeveloping beds, and my colleague from Whitby's riding, and that's a wonderful thing, but how can we trust them, Madam Speaker? They told us they would redevelop 35,000 beds, and I, for 2 years as critic, have been asking when and where, and I can't even get that list. So at times, and I hope he's sincere, I like him, but at the end of the day, his people are going to have to say when. When will it be done, and will we truly get those beds? Because we haven't seen those beds redeveloped, Madam Speaker. In my role as PC critic, I've been steadfast about holding Liberals to account, and it's not criticizing. Our job is to hold them to account for their many broken promises to seniors over the years. The fact is, after 14 years, life for Ontario seniors is getting harder because half of our nursing homes are crumbling and require redevelopment. In the next 7 years, Madam Speaker, is this even possible? Will they come out and actually say it will truly be done over the next 7 years? Every single bed will be developed. I want them to answer that question to the people of Ontario. 32,000 seniors have been waitlisted for a long-term care bed, and we know that's going to rise to 50,000, Madam Speaker. So again, we're challenging them and saying, what are you really going to do? What's the practical plan that you're going to put in place? Alternate level of care, or ALC pressures, have doubled. Exactly 6 months ago, there were 1,626 ALC patients in hospitals at a cost of about $1,370 per day. These were for seniors without access to a long-term care bed. So if there's twice as many ALC today, that's a huge cost, about $4 million, Madam Speaker, spent every day, and only because the Liberals failed to add new LTC beds. And at the end of the day, we know that number is going to get bigger. So if it's $4 million a day today, what's it going to be in 5 years, Madam Speaker? Scary. All of these facts demonstrate how terribly out of touch the Liberal government is on the seniors' file. Madam Speaker, consider that seniors in long-term care are suffering falls since this government slashed the physiotherapy budget. In fact, the incident of falls is double the provincial target. They promised to improve quality and safety, and yet we're seeing the incidence of falls dramatic increasingly. So what I can tell you is that when it comes to long-term care, this government has not delivered, and in fact has broken a majority of its promises to seniors with regard to ensuring they get better care. Similar to my colleague for Simcoe Grey, Randy Pettipies, the MPP for Perth Wellington, has been fighting to keep long-term care beds in his community too. His motion will be debated at the end of the month, calls on the government to halt consideration of the bed transfer proposal until the government fixes its its system. And for me, Madam Speaker, same thing at Grey Gables and Markdale and Rockwood Homes. Again, the Simcoe Grey member was the minister when that facility got approved. We should be actually expanding it, never considering that we're actually going to move it, Madam Speaker. So at the end of the day, they can start changing the way they respect seniors and the actions they take by supporting this worthy motion and add long-term capacity in Simcoe Grey and, in fact, across our province.
Thank you. Further debate. Further debate. I recognize the member from London Fanshawe.
Thank you, Speaker. And it's, of course, always a pleasure to stand in the House and speak to legislation, especially the private members' bills that we're allowed to bring forward from our ridings and have our voices of our constituents heard. And so the member from Simcoe Grey has brought his motion asking this government to increase the number of long-term care beds in his riding, and rightfully so. You know, and the member from the Liberal government has said, you know, we could probably look at every riding and we could all say we need increased long-term care beds. And there's a reason for that. The reason is because we have a situation where capacity, accessibility, and availability in all regions is a problem. And if this government actually acted on the motion that they passed, all parties here, I know the Conservatives supported it, and 2 cabinet ministers from the Liberal Party, from the Liberal government supported it. It was the motion that I presented to expand the public inquiry into a phase 2. And one of those items in that public inquiry expansion, and we want to look at systemic issues. And one of those pieces specifically talked about capacity, availability, and access in all regions for long-term care beds. So I have to say that when we're looking at long-term care, of course I'm the critic for the NDP in that regard, and that's my portfolio, we need to look at the full picture. We need to look at it, the honest problems as to what is actually happening in long-term care. It's just not solving one specific problem, because there are systemic issues. And over the years, we've heard from loved ones, we've heard from family members, we have heard from stakeholders, we have heard from CEOs of long-term care, we have heard from PSWs, from frontline workers, from nurse practitioners, from, you know, a range of healthcare providers, that there are systemic problems in long-term care. And if we look at actually looking at the full picture, we're going to talk about systemic problems in the scope of quality of care, staffing levels and policies, funding levels, how for-profit homes impact the long-term care system. We're going to talk about enforcement of inspections. We're going to talk about the actions and inactions of this government and what those effects had on long-term care. So, and Speaker, the capacity piece that I just talked about. And when we actually examine those problems, when we actually examine those concerns on a systemic level, we will find answers, we will find solutions that will work in the long term for the long-term care file. Because in the next 20 to 25 years, there is going to be an expansion of people who are going to require health care, whether it's in their home, whether it's in the hospital, or whether it's going to be in long-term care. And we're going to do a disservice to Ontarians if we don't look at the systemic problems of the long-term care system, Speaker. Because many of those people who are at home, who are seniors, can't get into a long-term care facility. They are then funneled into a hospital, into an alternative care bed, which means months and sometimes years to wait. And only a few years ago, Speaker, I recall that hospitals were forcing seniors to be discharged back to their homes or long-term care homes that they didn't want to be in, and they threatened they were going to charge them like $1,200 to $1,400 a day if they didn't move. Serious problems on long-term care. Thank you for the member of Simcoe Grey alerting that he needs increased beds in his riding. But Speaker, that's not the only issue in long-term care. It's throughout the province. We need to look at the systemic problems, address each one, take an honest look. It's called find and fix. Find the problems, fix the problems, have a long-term plan, and then, you know what, revisit those things on a regular basis so that we know we're doing it right and we're not caught off guard another 15 years down the road trying to fix long-term care. Thank you, Speaker.
Thank you. Further debate. I recognize the Minister responsible for Seniors Affairs.
Thank you, Speaker. And I am pleased to rise today and speak to this motion. I want to begin by first painting a picture of what has already been done in the North Simcoe Muskoka area. We have opened 333 new long-term care bed speakers since 2003. 50 beds at Grove Park Home for senior citizens, 128 beds at Victoria Village, 64 beds at Ontario Long-Term Care Home for the Deaf, 55 beds at the Pines, and 36 beds at Georgian Manor. And since 2003, we have also redeveloped 144 beds in long-term care homes in Simcoe. This is what we have done. But more exciting, Speaker, is what we have committed to do, which is we have said we are going to build 30,000 long-term care beds. So there will be plenty of beds for all of Ontario, including Simcoe Grey. So all I wanted to say is, Simcoe Grey is an important part of the province, but we have committed to, it's a once-in-a-generation commitment, Mr. Speaker, that we've committed 30,000 beds in it.
Thank you. Further debate. I recognize the member from Whitby, Oshawa.
Thank you, Speaker, and I'm pleased to rise in support of the motion from the member from Simcoe Grey. Our seniors need long-term care homes in their communities that are ready and capable of meeting their ever-increasing complex health care needs and able to provide safe, quality care when they expect and require it most. We have an aging demographic, Speaker, and we've acknowledged that. Ontario should have the best standard of long-term care, and long-term care residents deserve dignified, safe, and quality care and should never worry, Speaker, that their health and safety may be at risk. Speaker, the provision of long-term care in the Central East Local Health Integration Network, the largest in Ontario, which services the region of Durham and my riding, is illustrative of the increasing demands on the long-term care system. This local health integration network has the highest number of patients, Speaker, waiting for long-term care placements as compared to the other 13 LHINs, and has the highest wait time to placement days in long-term care compared to the other 13 local health integration networks. I raise this, Speaker, because it's indicative of the long-term care demands that the region of Durham and other regions serviced by the Central East Local Health Integration Network face presently and in the coming decades. And that challenge is evident in other parts of Ontario. Now, the current government committed to accommodate the 32,000 seniors who continue to languish on the long-term care bed wait list, a list, Speaker, that will reach 50,000 seniors by 2021. But once again, Speaker, we see no evidence that this promise will ever be honoured. Speaker, Ontario residents who require long-term care deserve more than long wait times and continued neglect from the Liberal government. Now is the time to provide assistance to the residents and the long-term care homes that serve them. And in the case of the resolution before us today, in the counties of Simcoe and Grey. At the end of the day, Speaker, this is about enhancing the quality of life and supporting the needs and seniors who built our communities. After all, with all the work that they've contributed through our communities over the years, we owe them no less. Thank you, Speaker.
Thank you. Further debate. I recognize the member from Dufferin-Caledon.
Thank you very much, Speaker. I'm pleased to speak on this resolution today. It's actually interesting. This Thursday afternoon, we have two healthcare-related private members' bills, resolutions, and they actually have quite a tie-in. So my colleague is talking about long-term care beds. He's obviously highlighting his own community, which he absolutely should do. The next PMB, private members bill, that we're going to discuss actually talks about the other end of it, and that's the pressures that our local hospitals are having as a result of what we call ALC, alternative level of care, bed blockers, there's all kinds of names for it. Basically what it means is people who are living in hospitals who need to be somewhere else. So I want to bring it back to my community because this is this has a ripple effect across Ontario. These statistics are actually from the Central West LHIN, and they're from November 1st, so they're very timely. What I want to do is I want to highlight for the members what is actually happening out there in our long-term care facilities. So in Avalon Retirement Centre, happens to be retirement centre and long-term care, happens to be in Orangeville. The waiting list right now per days is 360 days. So the average amount of time it will take for you to find a placement in Avalon is, well, just 2 days shy of a year. Let's move to the Dufferin Oaks Home for Senior Citizens in Shelburne. 481 days, so a year and a half. What is also interesting about that number is, for those of you who are interested in StatsCan information, the town of Shelburne is the fastest growing community in Ontario and the second fastest community in all of Canada. So if right now it is taking you a year and a half, 481 days, to find a placement in Shelburne, well, you know, bless you and good luck, because it's only going to get worse. King Nursing Home happens to be located in Bolton, 348-day wait. And again, these are averages. Shelburne Residence, another long-term facility in Shelburne, north of the riding, is 352 days. Vera M. Davis in Bolton, 662 days. Now, these happen to be the long-term care facilities in my community in Dufferin-Caledon, but frankly, as the member has highlighted, it's happening all across Ontario. The ripple effects are there. It is causing a backlog in our hospitals. It is causing incredible stress with family members who are truly scrambling to trying to find a placement for their loved one that is in some way close to where they live so that they can actually continue a relationship and have regular times to be with their loved ones. So it all comes back to when you cause a problem, and in this case, it's the access and availability of long-term care beds, you are causing a downstream problem with our hospitals, stress on our family, at the retirement home level, at the hospital level, at, frankly, our ability to provide home care. It's happening there, too. When people are more appropriately placed in a long-term care facility, but can't find one, or can't find one that isn't 5 hours away, then they pull in and they try to access more home care services. So it's a downstream effect that is impacting so many parts of our healthcare continuum. I suppose, Speaker, that's why they call it a continuum of care. And you know, there's a little bit of, but promise. Just trust us and it'll get better. The problem is after 14 years, there's not a lot of trust left. You know, at some point you have to say, show me the actions. So I think in Dufferin-Caledon, I'm certainly hearing it. They're tired of the promises. They're tired of the announcements that get dragged out, that get re-announced over and over and over again. They want to see action, and on this particular file, in the long-term care access, we haven't seen action, and we're tired of it. Thank you, Speaker.
Thank you. Thank you. I'll return to the member from Simcoe Grey to wrap up.
Thank you, Madam Speaker. I appreciate all of the speakers, and I thank you for the support. It sounds like it's going to pass, but you know, Madam Speaker, on June 1st, I had a resolution passed in this House, unanimously supported by all three parties, and I've yet to see any action from the government. So the member for Dufferin just talked about that in terms of we need to see action. So I had a resolution. Everyone agreed that the Collingwood and Alliston hospitals need to be redeveloped. Everything else in Simcoe County has been done. Dufferin's even been done during my time and next door to me. But nothing's happened to Collingwood or Alliston, so they're long overdue. And we're just asking for the planning grants was approved, as I said here. Parliament has spoken. Parliament's supposed to be supreme. You're supposed to do what Parliament does, but we have a little problem with implementation. It's 6 months away, or 6 months since, and I haven't heard very much. I hope the same thing doesn't happen here. I said at a meeting recently with some government people, well, are you going to come back to me next week and tell me when you're going to implement some of these resolutions that are piling up that I have on my desk as House Leader, because I keep track of all this stuff? And I actually got laughs from the other side. So this place isn't a joke, folks. I know McGuinty, we now know that during the gas plant scandal, he treated Parliament and committees, which are a arm's length part, or a continuation of Parliament, with disdain, and that's come out in the trials. You need to correct that record. You need to listen to the people of Ontario as represented by the people in this House, and you need to actually act on resolutions that you vote on.